how many of you have logged into MyLG HIP before? So you guys know you can download invoices from MyLG HIP. And just to reiterate what Chris and Meg and Tara said this morning, make sure you're reviewing those invoices. Make sure that you're paying for people that are supposed to be on your bill, and make sure that people that are supposed to be on your bill are on your bill. We don't want you, obviously, to be billing you for people that don't need to be on the coverage, and at the same time don't want you paying for that, but at the same time want to make sure that you guys have your records completely up to date, and we do too on our side. You can also do online enrollment. You can do online cancellation. Online cancellation has taken off. I'm keeping up with that on a monthly basis, and more people are using it, and we greatly appreciate it. There's still a lot more people that can use it. I know when we get cancellations in that are older than 30 days, that the enrollments teams are reaching out to you guys to encourage you guys to use the online cancellation because it's instant. You send it to us, it goes straight to our enrollments team, they work it, and they get those folks off the coverage that don't need to be on the coverage. And then the wellness percentage for your unit. So you can go on to MyLG HIP as the unit administrator and see where you guys are for your wellness percentage. On top of that, this past year, Marie James, our clinical director, worked with our IT team, Jason Charles and Joseph Hickson and Craig Tucker, on getting some notifications out to you guys starting in January. So in January, you guys should be receiving an email once a month that tells you where you are with your percentage. If you're not, reach out to Marie or come see Marie and let her know, because you should get an email as well as be able to see it on MyLG HIP. Now, that's once a month starting in January. Come July, if you are below 80% in July, you will get an email once a week reminding you, hey, you still need to get some folks screened. We're trying to encourage that, obviously, based on what Rob said today, for the well-being of our employees, and at the same time making sure that everybody has the same opportunity to gain that preferred rate. So just make sure you're reading those emails and checking them, and if you have questions, Marie can help you there. Now, as far as a member experience, members can go into MyLG HIP and look at all family members that are covered under the plan to make sure that's accurate. They can verify their contact information. They can also update email addresses, and they can review the wellness screening results and as well as trends, which is pretty neat. You can go in there and see where you're going with your weight, where you're going with your glucose, all the good stuff that they screen you about, and it shows you the trends up and down and all around. Now, one thing that's going to be coming very, very soon, and it's ready to go actually, is multi-factor authentication. So when you log in to MyLG HIP, there's supposed to be some slides. Yes. All right. They're not here in my hand. So multi-factor authentication, you guys are getting used to that on just about anything and everything you log into, where it says, hey, I'm going to send you a text with a number that you need to plug in here to make sure you are who you are. Same thing here. So with multi-factor authentication, you're going to go into the login screen just like you do today when you log into MyLG HIP. And when you do and you hit enter to log in, it's going to give you that red bar up there at the top, and it's going to say enter the six-digit email that was emailed to you, or six-digit number, I'm sorry, that was emailed to you. And it's going to go to the email that's associated with that login. You enter that six-digit number into the screen or into the field that it's asking you to log it into, and boom, you go in. And so it's going to be a very simple process, and one that we've got to put in for security reasons. And just to make sure, there's so many cyber attacks out there now, people getting their identity stolen with their user ID and passwords, that this is just another way to protect everybody. All right, next, benefit focus. So when I started back in 2021, we were going through the RFP process for a new benefit admin system. And at the conferences in 2021, we told you something new was coming. That was 3 years ago. We kicked off the project. We selected Benefit Focus. We kicked off the project in December of 22. So far today, we've gone through discovery, configuration, and we're in testing right now. This is a process, because one thing that we're not going to do is roll out a product to you that's not quality and that is not a product that we're proud of. And so we're in testing right now to make sure that we get to where we need to. Once we get to testing, there's a handful of units out there that want to be beta users, and they want to test this for us. We're not going to roll it out to everybody at one time. Y'all seen mushroom clouds, right? I don't want to see one in my future. So we're going to roll this out very, very strategically, and we're going to have a handful of beta units out there that go through this process with us. and utilize the system in a very probably limited capacity, just to give us some feedback. Because you're going to be able to do a lot in this system. I'm not going to go into all that today. We're going to keep this high level on this system today. But once we get to that point, we will reach out to those units and we'll start getting more information out to everybody. But where we are right now is within testing, and we're doing our best to get this thing moving along. So where are we now? I just told you what are the next steps. Next step's going to be hopefully the strategic rollout and talk to some beta units first and get them to utilize the system before we start rolling it out to everybody. All right, YMCA. So we have partnered with the Alliance of Alabama YMCA group to get all of our members, anybody that's a member and or a dependent of our member, of your members, to be able to sign up at the YMCA with no registration fee or the enrollment fee, membership joining fee. So that will be completely waived. On top of that, if your unit has payroll deduction and if that local alliance will give you a discounted rate, and you guys can do your payroll deduction through that with that YMCA directly, they may be able to give you guys a discounted rate for your employees as well. So that's going to be at a location per location basis, as well as unit by unit location or unit by unit basis if you guys can do payroll deductions. So we rolled this out effective September 1st. There's 16 associations throughout the state. There's 50 locations throughout the state, amongst those 16 associations. So we're excited to offer this. Again, it's a savings of around anywhere from $75 to $100 for the members, and all they have to do is walk in with their identification or their Blue Cross Blue Shield card showing that they're a member of the local government health insurance board, and they will have that membership fee waived. All right, white glove customer service. Again, that's been touched on as well, but it's something that we're proud of. It's something that David has asked us to make sure that we're doing, and that we are bringing the best level of service to our units and our members that we possibly can. And as Meg mentioned this morning, we did a survey of our members earlier this year, and we got a 90% satisfaction rate, and or it basically respondents that were very satisfied or satisfied with the services they receive from our team. Now, do I want 90%? No, I'd love 100%. Are we perfect? I wish I could say we were, but we're not. But with that said, that number will continue to grow. We like to recognize our employees, and it's not just for our members or our units. It's internally as well. There's a lot of things that happen in our building that affects our team, and what we do is we ask on a monthly basis for somebody to suggest or submit to me anybody you want to nominate for a white glove service award. And at our staff meeting, those folks are recognized. And so we take it seriously. And if we're not giving the service that we need to give to our members, our units, and or internally, we're going to talk to them. We're going to talk about it, and we're going to try to figure out how to get it there. So if you guys don't see that, come by and grab one of my cards and let me know, because we want to make sure that we're offering the best service that we possibly can. So with that said, I am done. Are there any questions? Perfect. Michelle, I'm going to turn it back over to you.
All right, Jason, good job. Thank you.